Hi, I'm Dr. Tia Brodeur, and I'm a reproductive endocrinology and infertility specialist at MU Healthcare. I was inspired to become a doctor when I was in college. I always loved science. In medical school, I had a general interest in women's health. I also liked endocrinology. Commonly, I work with patients who have conditions like PCOS, polycystic ovary syndrome. It's very common in most communities across the country, and this can cause trouble with ovulation, which can lead to difficulty conceiving. We all have a general concept of hormones and what they do, but they're essentially invisible to us. And so I really like to give people more information about how their ovaries function, how their menstrual cycle functions, and put that in the context of general health. I think communication is one of the most important aspects of the physician-patient relationship. From simple things like asking someone if they prefer written information or verbal information, if there's someone who likes to meet in person versus telehealth, just getting a sense of patient preferences can improve communication. So my approach to patient-centered care is to get a sense of what the individual goals and values are for that patient. I think that getting to know someone from where they grew up to what they do creates just a safer, more collaborative space for them to give me a sense of what they're okay with and what they're scared of. I would say trust is the most important factor in a doctor-patient relationship, and so I want people to trust that the information that I'm giving them is the best known evidence at the time. I was really excited to come to MU Healthcare because of the great reproductive biology that's happening here in addition to the clinical care. So as a scientist, I work in ovarian immunology to try to understand ovarian aging and inflammation in the ovary, and we have a really world-class group of reproductive biologists here as well as physicians.